What is stress? Stress consists of financial, emotional, and mental stress. What are the physical symptoms of stress and anxiety? They can be stomach ache, muscle tension, headache, rapid breathing, fast heartbeat, sweating, shaking, dizziness, trouble sleeping, and fatigue. The emotional symptoms are more serious. These can be feeling of impending doom, being pessimistic for long periods, panic, nervousness in social setting, difficulty in concentration, irrational anger, restlessness, and if there is a feeling of harming yourself or others, seek help immediately. Do not delay in seeking help. Stress and anxiety can progress into the following categories. Generalized anxiety disorder, or GAD, is a common anxiety disorder characterized by uncontrollable worry. Sometimes people worry about bad things happening to them or their loved ones, and at other times they may not be able to identify the source of worry. Panic disorder is a condition that causes panic attacks, which are moments of extreme fear accompanied by a pounding heart, shortness of breath, and a fear of impending doom. Post-traumatic stress disorder, or PTSD, is a condition that causes flashbacks or anxiety as the result of a traumatic experience. Social phobia is a condition that causes intense feelings of anxiety in situations that involve interacting with others. Obsessive compulsive disorder, or OCD, is a condition that causes repetitive thoughts and a compulsion to complete certain ritual action. What are the steps to deal with stress and anxiety? First, seek help. Mental health is not something you can solve on your own. You need assistance. Talk to your closest people around you, people that you can trust to give you help. Seek the professionals like the psychologists, the psychiatrists, counselors, and healthcare professionals. Do not delay in seeking help. Here are some good techniques for dealing with stress and anxiety. Mindfulness. Mindfulness is being aware of your surrounding, your present state of mind, emotion, and feelings, and being aware of your behavior. Pay attention to your own breathing, your heartbeat, and your muscle tension. You will feel your heartbeat increase, breathing is faster and out of breath. Blood pressure may rise, and you may be in fear, anxious, or nervous. CBT, or cognitive behavior therapy, is a well-known therapy that has proven to be useful. We often use deep breathing technique in CBT. Now, what this means is breathing in slowly to a count of 4, hold the breath to a count of 8, and breathe out slowly to a count of 4. This will slow down your heart rate and heartbeat deliberately through a behavior action. CBT is about consciously changing your behavior or action to avoid the stress situation. Now, is it the situation or behavior causing the stress? A lot of people think that situation or events cause your stress, and more often than not, it is the behavior. For example, in a traffic jam, if you have planned a 2 hours ahead journey and planned the route to avoid the jam or peak hours, you would have avoided the jam and be in your office in time, thereby avoiding a stress situation. So, don't blame the traffic jam, but blame your own behavior. Music therapy is another good way of de-stressing. Playing out a relaxing music that is tuned to a tempo of alpha range is soothing and calming to the mind. Music frequency waves does affect the brain waves and in a way soothe and affect the physiological functioning of the body. Earthing therapy or grounding. Now, our human body is filled with electrons, positive and negative ions. The modern day activities charge your body with static electricity constantly, and you don't give your body much opportunity to discharge. Try walking on the beaches or grassland barefooted. It will help to introduce the negative electrons to your body. People who do grounding a lot are farmers who goes about the chores with barefoot. Will tell you that grounding will promote better sleep, calming of the mind, and relieve your stresses. We wear insulated shoes from morning till evening, and our floors are insulated with vinyl or carpet with layers of rubber insulation. All these materials prevent your body from discharging the static electricity, which is many positive electrons. Positive electrons promote inflammation and a host of other illnesses. Earthing or grounding will promote a two-way flow of electrons. The earth is by nature negatively charged, which will attract the positive electrons from your body. So, be connected to the Mother Earth through your feet. What about diet and lifestyle? Avoid alcohol, caffeine, and nicotine, as this will make the stress and anxiety worse. Medications such as thyroid medicine and asthma inhalers can make the symptom worse. Talk to your healthcare professional if you have problem with this. Adopt a diet rich in complex carbohydrates like grains, fruits, vegetables, and omega-3 rich foods. Do exercise, walk, jog on the grounds barefooted. Vitamins, minerals, herbs are also useful for stress and anxiety. Chronic stress depletes vitamin B6. Several B vitamin status are integral to the synthesis of neurotransmitter and catecholamines, which are essential for psychological well-being, including serotonin and dopamine. A meta-analysis of 8 trials found that vitamin B complex with mineral supplementation for 28 days reduced levels of perceived stress, mild psychiatric symptoms, anxiety, and improved mood states. Some helpful minerals are magnesium, which may reduce anxiety. Those people who are on proton pump inhibitors, these are antacids that reduce stomach acids, may have hypomagnesemia. They may be required to replenish their magnesium. Omega-3 fish oil helps to improve neuron membrane structure. It is involved in endocrine and immune functions. Clinical studies by Kotsiros et al. In 2011 have shown beneficial effects of omega-3 fatty acids, improving the mood, reduce anger, anxiety, and depression states. What about herbal medication? Ashwagandha is an adaptogenic or anti-stress herb that shows significant reduction of high blood cortisol by cytoindoside 7 and 8. Ashwagandha reduces damage to hippocampal neurons. The compound retinoid A can reverse memory deficits and induce regeneration of dendritic spines and axons. Ashwagandha is sedative, showing GABAergic activity on ionotropic GABA A and GABA P receptors. Another useful herb is kava, whose key active constituent, kava-lactones, can modulate calcium and sodium channels, modifying binding of ligands to GABA receptors, inhibit noradrenaline and dopamine reuptake, and reverse inhibition of monoamine oxidase. A 2003 Cochrane review of 12 randomized controlled trials found that kava has significant effect in reducing anxiety scores. Other herbs include St. John's wort, valerian, passion flower, and sage are useful herbs that can help with stress and anxiety. Pharmacological treatment. Pharmacological medications may include selective serotonin reuptake inhibitors, serotonin noradrenaline reuptake inhibitors, and benzodiazepines. For severe cases where quality of life is impeded and normal activities are impaired considerably, pharmacological treatment is needed and should be under the supervision of a professional healthcare provider. Thank you for watching this video. Remember to take control of your own health.